Hello, welcome back to my home office here in Tampa, Florida. I am Lisa Melanson, co-editor and co-founder of the journal The Rhetoric of Health and Medicine, lovingly referred to as RHM. Today, I'm going to follow up the first video that I did about research articles and the peer review process with a review of RHM's other submission types, which are different from other journals. These alternate submission types are designed to provide content more specific to external audiences and also push the boundaries of what we're counting as scholarship across fields and disciplines. The first category I want to talk about are review essays. Most every journal does book reviews, but since much of the RHM scholarship has been dispersed across a wide array of journals and books and fields and disciplines, we wanted our review essays not only to review current scholarship, but bring it together. Sometimes in combination with creative policy and other types of extra academic work. And in bringing it together, we want it to advance knowledge about the field. So what this means is review essays are based on at least 3 works, which can be books, articles, policy documents such as standards of care or recommendations, images, videos, or even specific places like museum installations. These pieces under review need to have something in common, be it a common topic like, say, narrative, or a common disease or patient policy population like heart disease, or even a common methodological approach like grounded theory. The review itself would include a brief summary of each, but the bulk of the review essay, and let me underscore that, the bulk of the review essay would be building an evaluative argument that advances the field's knowledge about whatever your common topic is. Unlike book reviews, in which they are typically only reviewed by the book review editor, review essays in RHM will undergo what we're calling expedited peer review. One member of the editorial team, which is comprised of our co-editors, associate editors, and our review editor, will serve as one reviewer. Then there will be an anonymous outside reviewer who has a specialty in whatever your common topic is. Review essays will be assigned the same decision categories as research articles after peer review is done and can undergo the same sort of revision process. The next category after review essays that I want to talk about are dialogues. Dialogues are exactly what their name implies, a conversation between and among stakeholders around a specific topic or idea. I use stakeholder here deliberately because dialogues can be inward-facing, addressing the field of RHM, or they can be outward-facing, where we have invited other participants into a dialogue with academics. For example, we have been discussing at RHM since even before the journal was officially founded, that we wanted a dialogue around the idea of ethics, since so many of us are working in this larger area and ethical concerns underscore so much of the work of RHM. In this, we could imagine bringing in a number of different stakeholders, from a member of an IRB board to patients to physicians to bioethicists from public health and RHM scholars. From this assortment, one can imagine the diversity of thought that could occur within the dialogue. Dialogues can take any number of forms, such as a roundtable, back and forth conversation, circulated questions and answers, and any kind of media, such as a podcast, recorded roundtable discussion, video such as this one. We do have the ability to include multimodal accompaniments, and for this type of submission, they are particularly well suited to other modalities. So it's highly encouraged that you think through what type of other modality might work in addition to the textual or text-based piece of your dialogue. Because of this unique nature of dialogue, we do ask that if you have an idea that you query the editors first. Dialogues need to be approved in advance by the editors, but we are totally and completely open and are wanting to encourage with, lots of enthusiasm for you to send us your great ideas about what this dialogue could look like. Dialogues will also go through the same expedited peer review as review essays. The third category is the persuasion brief. The category is the RHM category that, while speaking to RHM readership, needs to specifically address an external stakeholder that is a non-academic audience or an extra academic audience. Persuasion briefs are RHM's version of a white paper, and they need to briefly synthesize and explain insights from a body of research about a particular set of health or medical practices, including applied communication context. They might follow the basic pattern of, here's the rhetorical research about topic X, here's what it has found, and this is why it could be useful or important to X. With the help of our assistant editors, we'll be marketing persuasion briefs to other audiences in an effort to educate those audiences about the work we do. So persuasion briefs are our effort to really be more public about the work that we do and about how our work can actually impact other publics. Like dialogues, we do ask that those wishing to pursue this submission type get in touch with the editors to talk about your idea. Persuasion briefs are also unique in that they can undergo expedited peer review or not. It's up to the author and what they may need in terms of their career. For example, we encourage early career faculty to do this sort of work, and we would definitely send that out for an expedited peer review because they'd likely need that at their institution. But on the other hand, a senior faculty member may not need or want that option. In any case, all persuasion briefs are reviewed by the editors and the associate editor for this section. The final category is the commentary. Commentaries are generally editor invited, but you can also send a query to us if you have an idea. They are shorter, not unlike editorial pieces in a newspaper. They can be inward or outward facing, should be about an especially timely topic. Commentaries do give you more latitude to be provocative, and we really, really encourage that sort of provocative questioning, but they are not rants and definitely need to be situated in RHM's research. These pieces will typically only be editor reviewed. For all of these submission types, we encourage the multimodal enhancements or supplemental materials. The options are limited only by your innovation and imagination, so be bold. And we encourage that sort of bold thinking. You can find a summary of this information on RHM's website at journals.upress.ufl.edu/RHM. And you can always email me or Blake at rhm.journal.editors@gmail.com. We look forward to receiving these alternative submission types from you all, and please reach out if you have questions. Take care.